Morning show. So it's a mid-morning cruise on Rhythm FM. 94.7 is the mid-morning cruise on Rhythm FM. Abuja is the mid-morning cruise on Rhythm FM. 94.7 is the mid-morning cruise on Rhythm FM. Oh, yeah.
Tune in every Tuesday from 10:05 a.m. on the mid-morning cruise at Rhythm 94.7 Abuja as we discuss health-related issues and more. Remember, health is wealth. Powered by Nizamiye Hospital.
It's an amazing time right here. Every time I come on here, it's just so beautiful to be on this particular dial. 94.7 is the dial that you need to be on right now. Good morning, Abuja. This is your host for the mid-morning cruise that comes to you every weekday from 10 a.m. till 12 p.m. My name is Awesome Ann. And Tuesdays are so special because we look at everything that affects your health, your well-being, and, the overall, situation when it comes to you as a person. We've had fantastic episodes on the show, and we've talked about different topics. Yes, but today we've got an amazing specialist in the studio, all the way from Nizamiye Hospital. His name is Dr. Attila Emiroglu, and he is an ear, nose, and throat specialist. You're welcome, sir.
Thank you so much.
It's so good to have you.
Thank you so much.
Yes, so today we're going to be looking at something that affects a lot of Nigerians, right? And that is the allergic rhinitis and nasal polyposis. Better put, these are diseases that affect the nose and the throat.
Yes.
Yes? Okay, so let's just go right into the questions. Now, I understand that the nose has a definition. So would you want to define what the nose is and all of the things that the nose does for us?
Yes. It is cosmetically also.
Okay.
In the middle of our face.
Right.
It is very important organ.
Yeah.
First of all, I want to cordially greet all of the Nigerian people
Yes.
By the way of this canal. Thank you so much for this opportunity which given to me.
You're welcome, sir. I'm sure they appreciate it.
Thank you so much.
Right. So let's go right into it. Tell us about the nose and its missions.
Yes. The nose in the people is very essential for the breathing and also it's essential for our life. So the nose have a lot of mission to provide us and provide the living things about the breathing and about the life.
Right.
So I want to mention some of its mission. The first one is the most important, being a part of the breathing pathway, a first part of the breathing pathway. So it is allowing us to breathe normally. If the nose has blocked, the normal breathing will not be able to be possible.
Right.
This is the most important mission for the nose. The second mission is heating the breathing air, especially at the cold country. The temperature of the breathing air may be minus 40, 50.
Right.
Can you imagine that if this cold air able to reach in our lung, what would happen?
Mm-hmm.
It would damage all our lungs and our alveolus.
Yep.
So the breathing will be not possible. So the nose is heating the air from minus 40 to plus 36.
Right.
It is a very important mission. The third mission of the nose is moisturization of the breathing air, again, to protect the lung from the dry air. And another mission is filtration of the breathing air.
Okay.
In our breathing air, there is a lot of particles, there is a lot of harmful pollens and some foreign bodies. It's contained inside the breathing air.
Right.
So this filtration mission is also up to nose.
Okay.
So this is another mission.
Okay.
The another important mission is to get the smell sense. We are smelling with our nose. If there is no nose, there is no smell.
I don't even know how
there
the
is no
smell will
taste.
look. Yes, I mean, honestly.
And also it's affecting our mouth test.
Yes.
So in the presence of the nose blockage, you cannot taste the meal very well.
Absolutely.
So you cannot understand what are you eating. This is another mission. And the last mission I want to talk about it. There is a lot of, but we cannot count all of them.
Right.
This is another important mission is the nose, to arrange the resonance of the voice.
Right.
While you're speaking, if you block your noise, your
You wouldn't
your
sound the
voice
same.
will change, and even your relative cannot understand who is talking about, who is talking with him.
Absolutely.
So the resonance is the another mission of the nose.
Right.
But we can call another things, but it's enough, I think so.
Yeah, so
As a mission.
just in case you're just tuned in, this is Healthy Tuesdays with Nizamiye Hospital, and we've got the amazing Dr. Attila Emiroglu. It's going to be an amazing show. He's so cheerful and, very passionate about what he's saying.
Thanks.
Yes, so we've just gone through the missions, or you would call it, the functions of the nose, and we talked about breathing. We talked about regulation when it comes to cold countries.
Yes,
whether it's
regulation,
yes,
filtration.
We've talked about moisturization. So that the lungs can be
yes,
protected.
yes.
We've talked about smiling, aids in your
Yes.
smiling. If there's no nose, no smile. And then it aids in our taste for food.
Yes.
And then, of course, it also helps to resonate our voices.
Yeah.
So if you don't have clear breathing, you might not be able to have a clear voice. Talking about clear breathing and clear voice, I was out last week. My
Yeah.
nose was blocked and then nobody could hear me.
Yeah.
Right, so we're going to go on to... So what are the commonest diseases with the nose in Nigeria? From your experience, what are the very common ones that you deal with all the time?
Yes. Usually, in other continents,
Right.
apart from the Africa, most of the continents in the winter, the weather is very cold.
Right.
So the most common nose problem in other continents is cold common.
Okay.
But in Nigeria,
It's hot.
Yeah, it's a hotter place, so you cannot see too much cold common
Right.
in this country and also in this continent.
Right.
But there is one disease more, which is going with the same symptoms with the cold common. Like sneezing, nose blockage, runny nose, itching, and nose blockage, something. These symptoms and also can be seen in another disease.
Okay.
And this is allergic rhinitis.
Okay. Right.
So, which is very, very common in Nigeria.
Okay. So
I want to speak about this disease,
Okay.
especially today. Yes, because of the existence of the plenty green area
Okay.
and harmattan season and also rain season
Right.
in this country, the peoples are usually exposure to a lot of kind of pollen and a lot of kind of dust
exactly.
in this country. So this is the main reason of the allergic rhinitis in Nigeria especially.
Okay.
Because of the being a first part of the breathing pathway, the first allergic symptoms, which I call like sneezing, congestion in the nose, runny nose, itching in the ear, in the nose, and also in the throat, so can be seen in the allergic rhinitis, and the pupils, supposing that usually this is cold common because of the similar symptoms of the cold common,
Right.
and they start to cold common treatment.
Okay.
And when they fail to treat it, and after that time, they came to the consultant
Yeah.
about these symptoms.
Right. So for how long would you notice these symptoms before you get so bad? This allergic rhinitis. How long do you think you would experience it before it gets to the point where we have to come to the consultant?
Yes, usually the cold common symptoms last 2 weeks, usually.
Oh, wow.
But the allergic symptoms can last months, years, or along our lives.
Wow.
So at the beginning of the symptoms, the people use 2 weeks cold common treatment. But when they see it's not helping them, and if after they understand something wrong,
Right.
after they come to the consultant. Yes. And the usually allergic symptoms is last a long time than cold common.
Right. So if we don't treat this allergic rhinitis properly, what are the things that can happen?
Okay. Excuse me, sorry.
No problem. So we're looking about things that can happen when we do not treat the allergic rhinitis.
Yeah.
Yes.
What will happen? Yes.
Right.
Okay. As the time passed, the proportion of the allergic rhinitis is increasing
Right.
all over the world.
Okay.
Because of some reason.
Right.
So the allergic disease are become important as the time passed in our life. So if the people don't care about don't care about the allergic rhinitis, many complications may occur within time, which vary from simple complication to life-threatening complication.
Yeah, please can you give us examples of this?
Yes, I want to count some of them. The first one and the common one is frequently or permanent nasal blockage.
Wow.
This is the first complication, and within this complication, the people cannot breathe very well.
Right.
And this blockage sometimes may be permanent, and they never can breathe with their nose.
Right.
And the second complication may be loss of the smell. We mentioned about its mission,
Yes.
one of that.
Yes.
So they can lose their smell completely. And the third one, recurrent or chronic sinusitis. Sometimes this sinusitis may be destructive in our face, and it may and it can erodate our bone in the face.
Oh, wow.
So it can reach the very dangerous area like
Yes.
eye or in the brain.
Oh, wow.
So this recurrent sinusitis is important complication of the allergic rhinitis, and the other one is asthma in the lung. And
That's very
also
common,
this is
yeah.
allergic disease, and it can be seen with together allergic rhinitis. The other one, the eye complication. Because of the chronic sinusitis, sometimes our eyes can affect from the infection.
Wow.
And the infection can pass the bone, break the bone, it can reach the eye, and so the complication can progress till blindness.
Oh, wow.
This is an important complication.
That's intense.
The other one is again, because of the recurrent or chronic sinusitis, the infection can reach to the brain, and the brain abscess or meningitis can be seen during the infection. Also, the last one I want to talk about, the snoring and obstructive sleep apnea syndrome. This is another complication of the allergic rhinitis as a big problem, and also this can threaten our life.
Right.
Because during the sleeping, in presence of the sleep apnea syndrome, the oxygen level of the blood can be very, very low, and the whole of the night you cannot breathe easily, and you cannot breathe properly.
Right.
And because of the low oxygen, the
Right.
brain will affect,
Right.
and also our body can affect because of the low oxygenization.
Right.
And this is another complication of the allergic rhinitis.
Right. So I want us to talk a little bit about nasal polyposis. Is it very different from the allergic rhinitis?
Yes, the nasal polyposis is a result from the usually allergic rhinitis.
Okay.
And after, when we exposure to the allergen,
Right.
like pollen or dust, something,
Right.
our nasal mucosa giving reaction
Right.
to push it out, and it is releasing a lot of mucus, and it is making sneezing to push it out. And because of this mucosal reaction,
Right.
the mucosa starting to develop polyp in the nose, and usually this polyp is blocking a breathing pathway, and also it's blocking to the ostium of the sinuses.
Wow.
And there is a hole which is running from sinus to nose,
Right.
which is provide our
Right.
sinus oxygenation.
Right.
So by this polyp, if it's blocked this hole, the recurrent or chronic sinusitis
Will
also can
continue.
be seen. Yes,
Wow.
and this is the main reason of the infection in the sinus.
Oh wow, this is something that everyone should be paying attention to. I know a couple of people who have problems with breathing. You know, their nose is constantly blocked or temporarily blocked. Most of the times they're breathing through their mouth, you know, and it's a problem, right? Yes. So if you want to join the conversation, we're going to open up the phone lines. Yes, 08178000947. This particular issue we're talking about today, allergic rhinitis and nasal polyposis, is something that actually affects most of us. I find it very disturbing, especially for children, because they really cannot help themselves. And they're the ones that actually experience this. You see a baby, let's say 2 years, is struggling, is and then it can go on for months, you know, and they're administering different drugs and different things, and it's not working. So, in that kind of situation, let's now go to the treatment of allergic rhinitis and its complications. Please, for children especially, what's the first and the best thing, you know, that can be done when you notice that a child has either of this? Because I think it's from them that, you know, it gets so intense. All right, let me take this question so we can just answer. Yes. Hello, good morning.
Hello.
Good morning to you, sir. What's your name? Where are you calling from, sir?
Hello.
Yes, we can hear you. You're live on air. Good morning. What's your name? Hello? All right, we can hear you. You might want to call us right back, 081-78000947. We are live with Dr. Attila Emiroglu. So we're looking at the treatment of allergic rhinitis and its complications, and I wanted you to please gear towards children.
Yes. The children, they cannot explain their situation. So we have to understand ourselves what's happening with the child.
Right.
Usually the child show the symptoms in their nose, breathing blockage, and also snoring.
Right.
Especially snoring, because one of the complication of the allergic rhinitis, because of the recurrent reaction in the nose,
Right.
and the adenoid tissue. This is one organ at the back of our nose, which is a part of the immune system. And because of the recurrent allergic reaction, sometimes it can enlarge, and it's permanently can block the nose breathing, and the baby or child start to snoring.
Right.
So if the baby is snoring, it's not acceptable. Never.
Oh, wow.
This is the main symptoms. If any parents see their child is snoring, there is important wrong on their body, so they have to bring the baby to doctor.
Oh, wow.
Absolutely.
Wow. Okay. Please, let's take this call. Hello, good morning. Hello, good morning to you. This is the Mid-Morning Cruise. You're live. Hello.
Yeah, good morning.
Good morning to you, sir. What's your name? Where are you calling from? Welcome to the show.
My name is Adenotonsillitis. I'm calling from Abuja.
All right, sir. So you want to ask a question?
Yes.
Okay, please.
I think I want to first of all thank you people for such a program. Is very educating.
Thank you, too.
We've seen situations where people see snoring as something that has to do with probably only lifestyle or probably just the weight. We've not seen it from the perspective causative reactions. I, for one, I know I have encountered one or two issues
Right.
that I had a similar problem. I snore, especially at the beginning of my own sleeping.
Okay.
And sometime I had some problem with that it was related to snoring.
Okay.
What they call sleep apnea. I had a situation where I was treating high blood pressure.
Okay.
And it refused to subside at all in any way. All the drugs were not functional until I saw a consultant again
Okay.
that came from the UK.
Okay.
And I was made to know that my blood pressure has nothing to do with just the other way it comes. There is a secondary reaction.
Right.
At the moment you sleep and your body doesn't have the right level of oxygen, just like he rightly said, that your blood pressure, your body will keep struggling to keep you alive, or the brain, whatever.
Yes.
So now I want to know how that can be, if there's any possibility of being cured.
Okay.
Yes, sleep apnea.
Okay.
And if there's any contact through which you can reach the consultant himself,
Okay,
that
sir.
would be very helpful.
All right, sir.
God bless you.
Okay, thank you so much for being detailed. Really appreciate. All right, so that was our dear architect on the show, sir, and he has a situation, sleep apnea. Initially, he was told that it had something to do with his high blood pressure, but when he saw a consultant, the consultant says, no, it doesn't have anything to do with your blood pressure. So he wants to know if there's a treatment, that can stop it completely.
For
the sleep apnea. Yes. Is there something? Is there a treatment that he can go by? And then he, of course, we would give him your contact right towards the end of the show.
Yes. For the thank you very much for this great question to clarify the others.
Yeah.
And also,
okay. All right. I wanted to just take that one call, but yeah, you can continue. Yes.
I can continue.
Yes, please.
Okay.
Yes.
About the sleep apnea syndrome, this is a very challenge problem. So, first of all, you have to know about the breathing pathway, because the sleep apnea syndrome may occur because of the two reasons. The one of them, the blockage in the breathing pathway.
Right.
The second one is central sleep apnea syndrome, which is a result from the brain issue. So the first one can be handled with the surgery.
Okay.
If the problem result from the breathing pathway blockage,
right,
you can treat it with the surgery.
Okay, you can actually surgically treat it.
Yes, there is some surgical treatment for the sleep apnea syndrome.
Okay.
To open the breathing pathway.
Okay.
But if the problem is result from the some central issue from the brain,
right,
it cannot be treated with the surgery.
Okay.
At that time, there is another treatment which called CPAP.
Okay.
The CPAP is a machine. While we are sleeping, the CPAP machine is giving us oxygen and the air on pressure. So it is stopping breathing problem. This is the overall the world. This is the latest treatment
technology.
Now.
Nice.
Yes. But if there is any obstruction in the breathing pathway,
right,
first you need to open the breathing pathway. So the patient needs surgery at first. Sometimes after surgery, this problem may disappear.
Right.
So first I advise the patient to see a consultant and to try the surgical chance.
Okay.
If the surgery is failed at that time, the CPAP machine can be given for the solution.
Okay.
That is solution.
Let's take this call too. A couple of people would want to talk. This is a very common problem. Hello, good morning.
Hello.
Good morning to you, sir. Good to have you on the show. What's your name and where are you calling from? Morning, sir.
Your program.
Oh, thank you so much, sir. Good to have you. Yes.
Your program is very interesting, and I used to learn every week.
Oh, wow. Thank you so much, sir.
Yes.
And thank you to Nizamiye, too, for powering this.
Yes.
Yes.
Greetings to your guest.
Thank you, sir. So you have a question?
Yes. Two questions.
Okay, sir.
About weather.
Okay.
So that the weather, if it's more than 35, it's a problem. And sometimes in Abuja, when we hear the news, like 40 degrees. So how can we, relate to that? Because where is the hospital? We need information so we can come there.
Okay, no problem, sir.
All
right. So we'll give off information as soon as, the show is almost coming to an end, all right? We always do that, so you just pay attention, okay? All right. So, more calls. Let's take this one. Hello. Good morning to you.
Hello, good morning.
Good morning to you. What's your name? Where are you calling from?
Okay, my name is Stella. I'm calling from Barry.
Okay, it's good to have you on the show, Stella. You want to ask a question? Go ahead.
Okay. Yes, I want to ask the doctor about sinuses. Okay, he said a lot about it. And I want to know if it's hereditary, if it could pass from one parent to the other, because I know a family that almost everyone in that family has sinuses. From the mother to the fathers to the children, almost everybody. So I want to know if it's something that could be passed on from parent to child, or if it's something that you could just get. How do you even get it? That's the question. Okay. So, and another question again is about this sinuses again. Could it turn to asthma at the end of the day? because a lot of times you notice that some people have sinuses, they have difficulties in breathing, and when you get to the hospital, they also recommend the same treatment they give to an asthmatic patient.
Right.
So that's basically, yes, what I want to ask. Thank you.
All right. So we've got a couple of questions. So I'll just run them through so you could answer. The first caller wanted to get your, details and to find out if there was a possibility, to get some treatment, just like the first person. And this next person wants to find out if it is hereditary sinuses. Is it something that is hereditary?
No, the sinuses cannot be hereditary.
Fantastic.
But allergic rhinitis can be
hereditary.
Yes.
Fantastic. So there's a difference between the allergic rhinitis and sinuses. Sinuses, not hereditary.
Yes.
Allergic rhinitis,
yes.
possibility.
Yes.
Okay, fine. So the second question you already answered, earlier. She's asking the relationship between sinuses and asthma.
Yes, there is a relationship. This is the asthma also allergic disease.
Yes.
So the treatment of the asthma is different than the allergic rhinitis.
Right.
So they need to go to the chest doctor or internal medicine to treat it. And there is medical treatment for the asthma.
And we'll just keep pushing all of them to Nizamiye. Don't worry. Okay, let's take this next question.
They can see
anyone. All right. Hello, good morning to you.
My name is Tunde.
Tunde, good morning to you. How are you doing? It's good to have you on the show.
I'm happy you came in with an ENT doctor this morning.
That's so nice. Thank you to Nizamiye for bringing him. So go ahead and ask your question.
My question is about nose bleeding.
Oh, nose bleeding. Okay.
Is there anything that can stop nose bleeding without surgery? And what can you do to prevent nose bleeding? Because this has been a challenge for a very long time.
Okay.
I can't afford to take a running nose catheter.
Okay.
I must not stress myself too much. I will have a nose bleeding.
Okay.
So, the depression.
All right. So, nose bleeding. He's been having nose bleeding for a while. If he stresses a lot, has some cold cough, he starts to bleed. Is there a permanent cure for that?
For the nose bleeding?
Yes.
So you first you have to know what is the reason of the bleeding, because there is a lot of cause.
Okay.
The one of them is allergic rhinitis, for instance.
Right.
If the issue is simple or reason is simple,
right,
you can check where is bleeding in the nose, and you can find out the vessel, which vessel is bleeding.
Okay.
And there is a permanent solution. You can burn it with the chemical, like silver nitrate as a chemical material.
Right.
And also you can cauterate it with electrically.
Okay.
You can stop the bleeding vessel, but sometimes under this bleeding may be important disease. Even the cancer in the nose can be start with the bleeding in the nose. So you need to know what is the reason.
Right.
And there is solution.
Okay. There's a solution for that?
Yes, you can find the vessel and you can burn it.
Oh, okay. And once you burn that vessel, it stops?
Yes. Usually.
What if another vessel starts bleeding?
But if the problem is, for instance, if there is some reason under the bleeding, like allergic rhinitis, first you have to treat the main disease. If you can take under control allergic rhinitis, it will not bleed.
Okay.
If there is polyp in the nose, which is the reason of the bleeding, if you remove the polyp, it will stop. You have to treat the reason.
Yeah. So you need to find the reason to stop the bleeding.
Yes.
Right.
Yes,
so Tunde, you heard that. You need to go find your way and see the consultant so he can trace the reason for the bleeding.
Yes, you have to know where is bleeding.
And possibly stop it. Okay, let's take this one call. Hello, good morning.
Hello, good morning.
Good morning to you. How are you doing, darling?
Fine. My name is Cynthia. I'm calling from Guaranton.
Your name is, sorry, I didn't get that.
My name is Cynthia. I'm calling from Guaranton.
Okay, Cynthia, good to have you on the show. You have a question?
Yes, I have a question.
Please go ahead.
Please, I've been meaning to ask, what are the factors that can lead to nasal obstruction? Sometimes you try breathing, but it's very hard to breathe. So I want to know, what are the possible causes?
Possible causes of nasal...
responsible for that?
Responsible causes for what?
Difficulty in breathing.
Oh, okay. All right.
Yes.
Thank you so much. So she wants to know what the possible causes are for difficulty in breathing. possible causes? What are the things that could cause you to have difficulty in breathing?
We are talking about it.
Yes, that's what we're talking.
The first one is allergic rhinitis.
Yes.
And there is some more. I told the complication of the allergic rhinitis in the nose.
Yes.
The nasal reaction, mucosal reaction, nasal polyposis.
Yep.
In the septal deviation in the nose also.
Yep.
And some pathologic tissue may develop in the nose because of a lot of disease.
Right.
And also adenoitis at the back of the nose, the tonsillitis in the middle of the throat.
Right.
So whole of this, or some laryngeal issues, whole of this way is on the breathing pathway. So any part of the breathing pathway may have any disease,
Sir.
which may blockage the breathing.
Yeah.
So during the examination, you can find out where is the problem and you can solve it.
It's obvious that
So
our
I want to
listeners...
speak about the especially treatment. We couldn't pass to the treatment.
Yeah, we are going to do the treatment, but we're going to have a part 2 of this because we haven't even looked at tonsils, we haven't looked at adenoids, we haven't looked at that, and the time is, it's not something we can even do in an hour because this is a major problem, in Nigeria. So we're going to look at the treatment for allergic rhinitis.
Yes.
And I want to plead for a part 2. So many people wanting to find out information.
They want, okay.
Yeah.
Can I talk about treatment now?
Yes, please talk about the treatment.
Okay.
Yeah.
So I want to speak about only for allergic rhinitis because we don't have time, I think so.
Yeah.
Unfortunately, there is no cure with the medication for allergic rhinitis. But we can take the symptoms and we can take the disease under control with the medicine.
Okay.
Yes, but this treatment will last along our life because I told there is no cure. But there is some promising studies to stop it with the medical scientists is working on it.
Okay.
So for now, they are trying to develop a vaccination for stop this allergy.
Nice.
And they are working on it, but the success rate didn't pass 60% yet.
Okay.
And it takes too long time. And you have to do this vaccination monthly.
Right.
3 years, 5 years.
Right.
You have to continue.
Right.
But they are trying to make it with the easy way.
Okay.
Like instead of injection, they are producing drop under the lung.
Okay.
Under the tongue, sorry.
Okay.
And they are dropping something in the mouth for vaccination.
Okay.
So it will be very easy. Maybe the people can use it long time.
Yeah.
And if they manage to increase the success rate more than 60%,
right.
Inshallah, in the future,
people
they
can
will
actually
manage it.
Yeah.
They are trying on it. But I want to speak about medical treatment first now.
Yes, please.
In order to take the under control of the symptoms of the allergic rhinitis.
Yes.
So there is a kind of medicines and there is 2 or 3 step treatment.
Okay.
So usually we want to start with the first step treatment.
Okay.
The low number of the medicine, the small number of the medicine and small dosage.
Okay.
First we start like this to reduce the side effect of the medicine.
Okay.
So the doctor can arrange the dosage or number of the medicine according to the symptoms or according to the situation of the patient.
Okay.
So we want to follow this kind of patient along their life to make them completely free from the allergy.
Yeah.
So maybe it takes time.
Right.
So the medical treatment can be arranged.
Okay.
We told about the second treatment, the vaccination.
Right.
And the other one, especially because of the allergic rhinitis, sometimes we talk about it, there are some complication may develop at the base of the allergic mucosa.
Right.
So the complication of the allergy can be treated by the surgery.
Okay.
Which I mentioned about the life-threatening complications.
Yeah.
This is very important because some of the patients, they don't care about it and their complication may progress.
Yeah, and they want to manage.
Yes, in
and
their
just drink
eyes,
some
in their
tea.
brain. And after, when they come, sometimes maybe they late. So the complication of this allergic rhinitis can be handled with the surgery.
Right. So when it's so complicated, it can be surgically treated.
Yes, sometimes.
But there's a vaccination they're working on now.
Yes.
60% way. So once it goes above 60%.
Yes, I was using when I was in Turkey.
Oh, wow. But is it here now?
I have 20 years experience about this.
Oh, wow.
I was using vaccination.
Wow.
There was a lot of patient with me. I was doing vaccination. The success rate, it was at around 60%.
Right.
But it's not underestimated because the 60 patient from 100 patient,
it's something.
They can be free from allergy. It's not small.
Is it something that we're doing here now in Nigeria?
I want to talk about it to maintenance of the medicine. And to get it here is not easy.
Right.
So unfortunately, we couldn't start here yet.
Yes, okay.
But it is on my agenda.
Please,
Inshallah.
sir.
Yes.
Please.
I will try to bring it here and I will start.
Yes. Very important because it's something that affects a lot of Nigerians. Like I said, I know I can count like on my hand 10 people that I know that are suffering, different some of all these complications, talking about asthma, sinuses, the nasal blockage and all of those things. So if it's something that can get to this part, we'll be very grateful. I mean, we'll be so grateful. Yes. So, we're only able to do the allergic rhinitis. I'm so sorry, guys, but we're going to try to see how we bring him again. You will come again, sir, so that we can look at the tonsils and adenoids and the chronic tonsillitis and adenotonsillitis, because that's a huge topic on its own. Yes, we're out of time, but we're thankful that you're able to break it down, and you see the calls, everyone participated and they understood and they're still calling, but that's the much we can take for today. But hopefully you'll find time from your busy schedule to come so we can do the other half.
Inshallah, the other topic can be talk about it later.
All right. So thank you so much, Dr. Attila. I learned a lot listening to you today. I picked up a lot of, gems I can practice at home. So before you go, what are the quick things that we can do, things that we can do to just make sure that we shield ourselves from the dust, the weather? I mean, Abuja weather is so intense. What are the things that you advise us to do?
Yes, especially to the allergic people, I want to give an advice. There is some protection ways from the allergic reaction and allergic complication.
Okay.
So in our test, we are doing allergic test to detect what is our enemy.
Right.
So the most important things to detect the enemy, and after the main treatment in allergy to avoid of them. So I advise them to do test and to find out what is allergic for them, and for the protection to avoid of them is very important. And there is some medication to protect them from the severe complication. We cannot finish the disease, but we can take it under control.
Yes, we can put it under control. This particular 30 minutes program was brought to you by Nizamiye Hospital. They're located at plot 113 Sector S, Cadastral Zone, Life Camp, Abuja. We will put up, this information on a mid-morning cruise page, or you could find them at Nizamiye Hospital on Instagram. They are there, so you can make inquiries. I understand that a couple of my listeners want to have direct contact with the consultant to the studio. So once you go to at Nizamiye Hospital on Instagram, you can send them a DM, all right? Or you can send a message to info@nizamiyehospital.com.ng. Let me spell Nizamiye. Nizamiye is spelled Nizamiye Hospital. All right. So this particular 30 minutes health show is powered by Nizamiye. Thank you so much, Dr. Attila.
Thank you.
Hoping to see you again for my own consultation.
Thank you so much.
Yes, and hoping that you would come for the part 2 of this particular show.
I'm very happy for this opportunity.
All right. Thank you so much. It was nice having you. The Mid-Morning Cruise continues with Awesome Man and Blossom Martin. Stay with us.